Pelvic organ prolapse, or POP, is when one or more of the pelvic organs droop down from their normal position into the vaginal walls. Your pelvic organs include the bladder, the uterus, and the rectum, and yes, any of them can drop down if they lose their support. I'm Dr. Alex Hill, and I'm a board-certified women's health physical therapist. There is a lot of misinformation out there about POP, so let's sort through some of those common myths and get you the right information. Myth number one is that your organs are going to just fall out of your body onto the floor. The truth is, although it might feel like your organs are just going to fall out and drop down, they are connected to your pelvis by really strong connective tissues. With more severe cases of prolapse, the organs might come down out of the vaginal opening and you can see or feel them, but again, they are still connected to your body, so they won't just fall out completely. If we look at the organs here, we have the bladder in the front, we have the uterus and the vagina in the middle, and then the rectum in the back. So again, with prolapse, that means that, for example, if the bladder is starting to drop down, it's falling down into the wall of the vagina. If it's the uterus dropping down, then the uterus dropping down into the vagina. And then if it's the rectum that's falling down, then that's drooping down into the wall of the vagina. So if you feel something or see something, it's not the organ itself, it's just the organ pressing into that vaginal wall, and that's what you're seeing or feeling. Myth number two is that only one organ can prolapse. The truth is, a lot of people think that only the uterus or only the bladder will drop down, but in reality, the uterus, bladder, and rectum can each drop. You may have just one organ drop down, or you could have two or even all three that start to drop down into those vaginal walls. It's important to know which of your organs have started to drop, so make sure that you talk with your medical provider so you can figure that out. Knowing what type of prolapse you have can help explain some of your symptoms, like if you're having trouble emptying your bladder or your bowels, having to change positions on the toilet, or use your fingers to support your tissues to help empty your bowels, or even some dull abdominal or back pain. Myth number three is that you cannot do high impact exercise if you have POP. The truth is, you really can do any exercise that you want, but many people do need to modify their exercises, at least initially, while you work on improving your pelvic floor strength, core strength, your coordination, breathing, and how you're doing the movements and activities and exercises that are causing your POP symptoms. It's best to work with a pelvic health physical therapist who can assess your movements and your pelvic floor muscles to really start an individualized program for you to get back to what you love doing without so many symptoms. I've worked with people to get them back to running marathons and competing in CrossFit events and more. So make sure that you work with a pelvic therapist and your coach if you have one to really optimize your movements to decrease your prolapse symptoms. Besides working on your pelvic floor and your core and form, you may also benefit from using a pessary to provide internal support for the organs. We'll talk about that in a little bit. Myth number four is that POP only happens after pregnancy or after vaginal delivery. The truth is, you can develop POP even if you've never been pregnant. Although having a vaginal delivery and being pregnant are risk factors for POP, some other risk factors for developing it are chronic straining for constipation, chronic coughing, repeated heavy lifting, especially if you don't have the optimal form in breathing, and lower estrogen levels, especially after menopause or cancer treatments. So yes, pregnancy is a risk factor, but you also need to consider some of these other medical and lifestyle factors as well. All right, now to myth number five, which is the last myth, is that surgery is the only treatment for POP. The truth is, there are conservative treatment options for managing your POP and your POP symptoms. The first things that you should be implementing are pelvic floor physical therapy, and consider, again, using a pessary. In pelvic health physical therapy, your PT will perform a very thorough examination, asking you a lot of questions about your symptoms, doing a general musculoskeletal exam, and then finally, a pelvic exam. The The general exam and the pelvic exam will provide a lot of information for your PT to provide you with a comprehensive and individualized program. And no, it's not always just about the Kegels. Often with POP, people need to be instructed in their proper breathing and coordination of their pelvic floor muscles, as well as changing their body mechanics or their form with doing daily activities and exercises that are making their prolapse symptoms worse. To learn more about pelvic health physical therapy, I'm going to be linking a video in the description below and at the end of this video, so make sure you check that out. Besides pelvic PT, pessaries are often very helpful in reducing prolapse symptoms. Pessaries are small devices, often made of silicone, and they're inserted into the vagina, and they're going to help with supporting the organs. This is just one example. There's a lot of different sizes and types of pessaries. A gynecologist or urogynecologist will make sure that you're fit for the right size and the right type for you and your symptoms. The pessaries can be removed nightly or for some people weekly for cleaning, and then when you wear them, you should not have any pain. You really shouldn't feel them when they're inserted. Other things you can do to help decrease your symptoms and help reduce the risk of the prolapse worsening are avoiding straining and stress on the pelvic floor muscles. This means managing your weight, avoiding constipation, and not straining hard for bowel movements or while you're exercising. If you need tips for constipation, I have a whole playlist on bowel health and improving your constipation on my channel. The last conservative treatment that you can consider is using a local estrogen at the vaginal tissues. After menopause or treatments like cancer treatment, there's a decrease in estrogen, which can make the vaginal and pelvic tissues thin. So using an estrogen cream in the vagina can help to improve the tissue health and collagen and help with decreasing your symptoms, along with these other exercises and strategies that we're talking about in this video. Hormonal treatment isn't for everybody, and it should be a discussion that you have between you and your medical provider. All right, I hope that this video was helpful in addressing some common myths about prolapse and maybe addressing some of the fears that you have. Please like this video if you learned something new, and for prolapse safe exercise routines to get you started, keep watching until the end videos for some effective programs that I've made. Make sure that you subscribe to my channel for more videos on pelvic health and pelvic organ prolapse.